The caregivers at FHN have been preparing for quite some time in the eventuality that we do have a coronavirus case. So a lot of training is occurring with staff, as well as looking at how do we reorganize our entire hospital to make sure that if we do have a positive case, that we're able to isolate that case and any other patient that would be testing positive. We've been looking at our surge capacity, which is the total number of patients that we can treat, as well as preparing our staff with what they should be thinking about, what kind of supplies do we need, and in addition, as I had mentioned, making sure that we have everything in place and we're ready to mobilize what those things are should we need them. That question we really can't answer because we don't know what the actual demand or the need would be. So for me to say yes, certainly that could end up being a crisis, because if we have a huge outpouring, we may not be able to meet that demand. But currently we are well stocked and prepared to meet a pretty significant need. The testing criteria is shifting almost daily. So as the CDC is putting out new guidelines, so the Centers of Disease Control and Prevention, the requirements for testing and screening are changing. Currently, what the screening guidelines would really be for high priority individuals. So those would be folks that have immunocompromised conditions, high risk factors, are above 50 years old. That would be higher candidates for testing. That doesn't mean that people that aren't tested couldn't carry the coronavirus. It just means with the limited resources we have available, we really have to prioritize for those that are in need. That screening is best done by a healthcare provider. Once a healthcare provider has had a chance to do that screening and they feel as though it would be justified to do testing, they would enter an order in for the test to be completed, and our staff would complete that test and get it sent out to a laboratory for processing. It was an important decision to be able to do mobile testing, one, to try and protect the people doing the testing as well as all of the people coming in to be tested. We don't know that everybody that comes in is going to be positive, and in fact most of the tests, all of the tests that we've done so far that we've received results on are negative. But there could be somebody who is positive, and we don't want those groups of people being put together in a confined space. So providing a drive-through location keeps it out in the open, keeps the traffic down out of our main facilities, so it reduces the chance for exposure, and it also allows for that social distancing that we're hearing so much about. That's kind of mentioned earlier with the screening, with how do you get testing, what criteria do you have to meet. And that's talking to a healthcare provider to be able to take the person through a screening algorithm and determine if they are at high risk. And if they are at high risk, then that healthcare provider could enter in an order for a test, and then the testing would be scheduled by making an appointment. We won't do any testing unless that person has an appointment that's been made by a provider, and then they would show up at the mobile testing site. We would gather the sample and get that out for processing. One of the things is that we need to make sure that we're validating it's the same person that has an order for the test, so making sure that you're bringing identification. There'll be some additional questions and screening that'll occur at the testing site, and then the nurses will guide you through the process of what the testing is going to be like. It is a fairly uncomfortable test. We'll be testing both sides of the nose, which includes taking a swab and going deep into the nasal cavity and towards the pharynx, or down the back of the throat. So once again, that's something that people need to be a little bit more mentally prepared for, but our nursing team will help instruct people on how that specimen collection will occur. I think one of the biggest misconceptions is that it only impacts old people, and it can impact a lot of different age groups. Currently in Illinois, we've had positive people demonstrating symptoms from age 9 to 99. And just because you're under 50 doesn't mean that you can't become ill. And it's really important that you realize that you could be carrying it and introduce that to somebody who's at a higher risk. So just because you're not necessarily in a certain age group or you don't have an immunocompromised position doesn't mean that you shouldn't take it seriously. And more importantly, should really be thinking about protecting others. I know it's very tough for people with young children to isolate them from grandparents or from older individuals. But once again, just because somebody isn't of a certain age group or a certain risk type doesn't mean that you can't still be carrying the virus. Studies are still inconclusive in that age group. There hasn't been a lot of data that's come out to say exclusively this is what happens. We do know that typically they're lesser impacted than the older age groups, but there's still a lot of information that is yet to come. There's a lot of limited trials that have been out there and limited observations, but nothing very conclusive at this point. I believe that it's really going to be all of us adhering to our local guidelines, government officials, and best practices that are being put out there. As we look at social distancing, washing our hands, not touching our face, and making sure that we report symptoms early on is probably one of the best things to start now. When we think about all of the research that's currently happening, some of the best and brightest minds in the world are working on trying to find a treatment algorithm, and I believe that that will be forthcoming. When that is, we don't necessarily know. But in the meantime, what we have to do is all of our parts by trying to contain and to reduce the potential spread. I would ask them to take a step back and think about somebody who they love who might be at high risk. And we know that any death is a significant loss, but if it's an unnecessary death because we can take a few inconvenient steps to help protect other people, I think it helps put people a little bit more empathetically in perspective that they have a role to play in this, and it's not something that we should be dismissive of. My family and I were just trying to keep healthy activities up, so making sure that we're eating well, keeping hydrated, getting our rest, playing lots of board games, spending time together, and trying to be as productive as possible while we have removed a lot of our extracurricular activities. So really focusing on taking advantage of this opportunity to be a family. One of the things that we're doing is trying to make sure that we post that factual information on our website, which is www.fhn.org, and there is a link to the coronavirus page. We are only putting out validated or factual information. We rely very heavily on the Illinois Department of Public Health. Their website also has a number of resources that people can tap into, and also working with the Centers of Disease Control and Prevention. So we're linking to all of those sites from our webpage, which again is www.fhn.org.